Right, well, good morning and welcome to the Oral Health Forum Session 3 on Sustainable Development and Green Dentistry. My name is Stephen Hancocks and I'm editor of the International Dental Journal and editor-in-chief of the British Dental Journal, and it's my pleasure to welcome you here this morning. I have to say that green dentistry is not something that immediately leaps to mind. And when I said to people that I was coming here to Hong Kong to chair a session on green dentistry, they wondered if this was a revolution in coloured filling materials. I did a quick Google check and I found that in relation to dentistry there were two main green issues. One was that, very pertinent to this area of the world, allegedly, green tea is very good for periodontal health, although I'm not very sure about the robustness of the evidence for that. And also, of course, there is the green and vermilion periodontal index. And I have to say I've never met doctors green or vermilion, but I've always been suspicious, even from being a student, that two people with names that were colours could actually come up with a periodontal index, but I'm sure that there's some very good explanation for that. Vermilion, of course, being very pertinent to gingival tissues. Also, I suppose, in the context of colour, or perhaps we should say in the rainbow of colour, how interesting that we still use the black classification for cavities, and black and caries. Maybe there's a connection there. Anyhow, enough of this speculation on colour. I think the other aspect of green dentistry and sustainable dentistry is that people kind of go, well, I'm really not sure how that applies to dentistry. How can we be more green in dentistry? And I think there are two objectives really for this morning's session. One is to raise awareness, and the other is to look, as indeed the previous session did, at what the FDI can do to perhaps take these things forward. Now, certainly in terms of raising awareness, my memory of 1996, the annual World Dental Congress in Orlando, was that at that Congress, a specialist group called the Tobacco Cessation Group in Dentistry emerged. What, I thought, has tobacco got to do with dentistry? That's really quite bizarre. Well, I don't suppose there'll be many people at that session, and in fact, there weren't a lot of people at that session. But of course, what that did was to start awareness raising. And who would have thought that in the space between 1996 and today, my maths isn't really terrific, as you probably know, the world falls into three types of people: those who can do maths and those who can't. But in that short period of time, we've seen a revolution in tobacco cessation in dentistry. And I believe in the same way that the objectives for this morning's session are to look at raising awareness and what individuals may be able to do in their practices and in their clinical work, as well as what the FDI can do, we've seen exactly the same thing in tobacco cessation, that actually it is quite a straightforward thing for a practitioner or an oral health professional to ask a patient, do you smoke, and to start the dialogue. And I think we're going to find this morning that there may be similar things that we can ask as individuals in our practices, as well as more corporate and federation-driven ideas and objectives that we can look towards. Now, as you can see, we have four very eminent speakers ready to take us through their areas of expertise and knowledge this morning. Susan Wilburn, who is the Technical Officer for Occupational and Environmental Health at the World Health Organization. Peter Soer, who is the Senior Vice President Unilever Oral Care, and of course partners with LLL, with the FDI. And also we have David Williams, who is an IEDR past president, And last but certainly not least, Claudio Fernandez, who is on the FDI Science Committee and was a representative at the United Nations Rio+20 conference earlier this year. Now, each of our speakers is going to give us a brief presentation, following which we're going to have a brief panel discussion, but we are also very, very interested in the input from you, the audience, today. So that will come towards the end. So without further ado, I would like to ask you to give a huge Hong Kong welcome to Susan Wilburn. Susan.
Good morning. Thank you, Stuart, and thank you all for being here this morning. I am really privileged and delighted to be here for the beginning of the Green Revolution in Dentistry, and was very interested to participate in the session earlier on oral health. As a public health, occupational and environmental health professional, I always learned in public health school about the advances in oral health in dentistry and how much a public health perspective dentists held. And so hearing the discussion this morning reinforced that. I want to thank Jean-Luc Isley for organizing this session and Julian Fisher from the Dental Federation for the deliberations and thinking that went into the planning of this session this morning. I'm going to talk a bit about a number of UN conventions, treaties, and activities that have been ongoing in the past year and in the next year, and hopefully be able to help you think about how you and your federation can engage it as this work moves forward. Thinking first about the UN Congress on Sustainable Development that was held this past June in Rio de Janeiro, for which you did have a representative. Some of the key messages that WHO brought to that meeting in Rio were that health is an important input to sustainable development, that this will be of no surprise to any of you. Healthy people are better able to learn, to work, and to contribute to their economies and their societies. And the additional message is that universal access to health services, including dental health services, is a key input to better health. Certainly not the only determinant, but a key input. Sustainable development can improve health, and I'll be talking about a few examples about how smart strategies for transport, housing, energy, and agriculture not only reduce non-communicable diseases, but also the diseases of poverty, and can enhance health. And this, however, is not the least bit automatic. If you were looking at the first draft of the conference agenda from last January, before this June's Rio+20 conference, you would have found mention of health only twice in the 300 pages of conference documents. Between January and June, many of us worked together to increase the outcomes in Rio so that there were key outcomes, calling on universal access as one of the key outcomes. And the second, which is the last on this slide, is that health indicators can help to measure the success of sustainable development goals and the governance of sustainable development. And to that end, in Geneva, we've been working in the past year with colleagues globally to develop a set of health indicators that will go into the Sustainable Development Goals. And there is a conversation this Friday in Geneva at the United Nations Environment Program on moving forward with the next Sustainable Development Goals to replace the Millennium Development Goals, which, as you know, will be finished in 2015. So looking at how development choices can reduce pollution, injury, and improve health, and linking health to green economy strategies and green dentistry strategies. And I don't mean green teeth. So green urban transport can reduce chronic disease, injuries, and improve health equity. Transport that's reliant on private vehicles increases congestion, pollution, physical inactivity, and, as we know, motor vehicle accidents, where safe walking, cycling, and rapid transport networks can reduce injuries, can reduce cardiovascular disease, and support healthy physical activity. Cycling to work, there's some nice research that was done both in Shanghai, near to here, and in Copenhagen in Europe that demonstrated a 30% reduction in premature mortality among commuter groups when cities made bicycle commuting more accessible and safer. Rapid transit and exclusive bus lanes improve access to schools, to jobs and services for poor children, women, elderly, and disabled, and increase equitable access to health care. Now, looking at household energy, you may not know that over 1 million deaths per year occur, mostly to women and children, from indoor smoke, from cooking using solid fuels. So that if we can improve access to clean energy, we can reduce these 1.5 million deaths to women and children by having the rates of childhood pneumonia, reduce time spent fuel gathering, which means there's more time for girls who primarily do the fuel gathering to attend school, and support what is this year the year of UN sustainable energy, and achieve the Millennium Development Goals of reduced childhood mortality and reduced pneumonia deaths. We can also reduce deforestation. In Western China, much of the light and heat comes from burning solid wood fuels, and it's deforesting many of the forests and increasing the carbon footprint. There are also, in addition to the carbon footprint from fossil fuels, methane and black carbon are now known to be serious greenhouse gas pollutants. The third example that greening the health facilities can expand coverage of maternal, child, and emergency services, certainly also dental services. A recent analysis that we've done at WHO has documented 21 to up to 59% of health clinics in 6 African countries had no electricity whatsoever. So that if you are giving birth at one of these clinics, you'll be giving birth by flashlight or in car headlights is what happens in the evening. And as we all know, babies don't choose to be born just during the day. In these same clinics, up to 12% had no access to clean water. And this is defined as from an improved well or pipe source. So that we're working together in a number of countries in Africa and in Vietnam to use solar panels to provide basic electricity for lights, for cold chain, for vaccines, for solar refrigeration in the cold chain, diagnostics, telecommunications, and water pumps, all essential. So as we think about sustainable development, we think about how health is a measure of sustainable development. And some of these policies that we were successful in integrating into the Rio+20 dialogue included universal access to health services, included an understanding of the need to analyze the health co-benefits of sustainable development and not just look at economics and not just look at the environment. And to that end, to develop health indicators to provide the metrics for sustainable development for monitoring and evaluation. The health sector is already showing leadership, and WHO is working to support and reinforce. I mentioned the Light for Life, using modular solar panels. You can see this solar suitcase. I'll show you another picture of it being used in Nigeria. On the one side for the developing countries, and on the other side for developed countries. We know that in Europe, 5% of the carbon footprint comes from the health sector. In the UK, the Sustainable Development and analyzed the carbon footprint of the National Health Service and determined that 25% of the public sector carbon footprint came from health sector activities. In the U.S., 8% of the carbon footprint comes from health sector, so that if we meet the goals of the UN Year of Sustainable Energy for All, those goals include a 50% increase in energy efficiency by 2030 and a 50% increase in the use of renewables by 2030. The health sector can provide more equitable access and also meet these UN goals. The hospital on the right is a children's hospital outside of Florence in Italy that was built with, as you can see, a green roof and a combined heat and power, so that hospital saves 1/3 of energy costs compared to other hospitals of the same size in Italy. WHO has been working over the past few years in the project that I am responsible for, Healthy Hospitals, Healthy Planet, and how the health sector can lead by example to reduce our carbon footprint. This is a result of the World Health Assembly resolution in 2009 about climate change and climate mitigation and the responsibility of the health sector to lead by example. So these elements of a green hospital or a green healthcare facility include the building design, to build facilities that are appropriate for local climate conditions, that are optimized for energy efficiency and resource demands, that are safer building materials, asbestos and lead-free, that are sited so that public transportation and easy access can be achieved, and that the kind of methods of transportation that are used by the hospital or the facility, the ambulances, for example, are eco-ambulances with natural ventilation. Alternative energy generation to produce and consume renewable energy on-site, and energy efficiency. This goal of 50-50, one of the areas that I think that the Research Federation and the Research Association should be looking at is low-energy dental devices and what kinds of dental supplies and equipment that require electricity can be made for direct application to solar applications or wind applications, things that we're doing with ultrasound in Africa at this moment and with LED microscopes in South Africa for TB diagnostics. Waste and water, I'll speak a bit more of that in a moment. And patient and worker safety are all a part of what is a green healthcare facility. And looking at the chemicals that we are using to treat and to disinfect and sterilize, and what are their impacts on patients and the environment. There are, in 2 weeks' time, in Nairobi in Kenya will be the meeting of the International Conference on Chemicals Management, where they will consider a report on engaging the health sector in the integrated approach to chemicals management, both by looking at the chemicals that we use in our sector and how to improve their safety through the life cycle, but also looking at how the health sector, in our role as professionals, can educate the public about chemicals and, in fact, educate other sectors about their use and management of chemicals. As you all know from the discussion yesterday, there is a Mercury Treaty, a legally binding global instrument for mercury. And as we heard in the discussion earlier today, for the phase down, as WHO is advocating, of the use in mercury in dental amalgam. These are two important international bodies and deliberations for which the Dental Federation is necessary to represent you, and that dentists need to educate yourselves, your colleagues, and your representatives in these negotiations. So now, just to give a few examples of where the health sector is already taking leadership in these categories of greening the health sector, you can see a nurse using one of the solar suitcases to light up a maternity ward in a facility in northern Nigeria that's totally off the grid. I would love to have some examples from dentistry and good practices of where this could occur in dental settings. Another example is in green building design. We have developed and published at WHO in the last 3 years guidelines for natural ventilation for infection prevention and control. And you can see the design in the top half of a hospital in South Africa that is designed with natural ventilation to treat patients with multiple drug-resistant tuberculosis. We can also see that when you use natural ventilation, you can save money. $800,000 was saved at a hospital in Singapore. And the photograph on the bottom right is from Hong Kong, is from here, the Grantham National Hospital, which has used natural ventilation for TB infection control since 1957. And then the research that was conducted during the SARS epidemic demonstrated its effectiveness to prevent transmission of the sudden acute respiratory syndrome, both to patients and to workers. And as some of you may know, in some countries, 50% of the cases of SARS were health workers who were exposed at work. Leadership in addressing transport to health facilities. There's a hospital in UK that provides interest-free bicycle loans and bus passes that has resulted in a reduction in cars on campus and a reduction in car use by staff. I mentioned earlier the eco ambulances. This is an example from Sweden where they changed the methods of speed in the ambulances, reducing the speed by, they put governors on the speedometers so that the ambulance drivers could not speed the ambulances. And of course, the ambulance drivers thought that this was going to risk patients arriving safely at the hospital in a timely fashion, when in fact they had a reduction in fuel use and a reduction in insurance bills from accidents by ambulance drivers by half. Here's an example of water and waste in an integrated management plan in India. The issue of waste management in healthcare is a major problem and was the subject a year ago of the report of the Special Rapporteur from the UN that said that the unsafe management of healthcare waste was a violation of human rights. Here's a design of the Sambhava Trust Clinic, which is a clinic taking care of patients that suffered under the Bhopal tragedy in India over 20 years ago now, where they're harvesting rainwater for hospital use. They're using solar water heaters and natural and passive ventilation to reduce energy and to improve the number of air exchanges per hour. They are using some of their rainwater for irrigating their gardens, and it's a medicinal garden that's outside this clinic that's providing some of the herbs for treatment of the patients. The last slide is about mercury-containing measuring devices, not amalgam, but sphygmomanometers, blood pressure, and thermometers, and examples of the WHO partnership with the NGO Healthcare Without Harm to reduce and phase out the demand for mercury-containing measuring devices by 2017. You can see a group of nurses and technicians from the Philippines on the top right with their digital thermometers, and on the bottom right, a poster from a campaign in a hospital in Sao Paulo in Brazil, where the state of Sao Paulo has now phased out the use of mercury-containing measuring devices. Very important in this goal of achieving mercury reduction, a potent neurotoxin, is to shift the production of mercury thermometers, which are mainly in India and China. And it's interesting, in the Philippines, you can buy the same digital thermometer at a lower cost than in China, where it is produced. So there's work that we all need to do about the market and being able to factor in life cycle costs and achieve these health benefits. Again, I want to thank you for your attention and for the work that you are about to begin in green and sustainable dentistry, and how you will contribute to the success stories and good practices for WHO to bring forward and for your representatives to bring forward at future international deliberations. And while some of the evidence, well, all of the evidence about global warming is in, and the only disagreement is what is the total impact of humans on it. However, the benefits to public health and population health from reducing our carbon footprint, improving our energy efficiency are great. Here's some of the websites from the materials that I've talked about, and again, I look forward to working together with you and to hearing from my colleagues.
Susan, thank you very much indeed. I think if we'd looked for a more inspirational start to this debate, we couldn't have found one. That was absolutely extraordinary and so all-embracing. It kind of makes us shiver a bit, doesn't it? But never mind. We're dentists and we have the practical solutions, don't we? So let's plough straight on. And I'm next going to invite Peter Soer from Unilever to come and address us. Peter.
Great. So thank you, Stephen and Susan, and it's a great pleasure to be here this morning and to have the opportunity to talk to this distinguished audience on a subject like this and break really, I think, new ground. And I'd like to thank the FDI World Dental Federation for giving me and Unilever this opportunity. So how will I spend my 15 minutes with you this morning? I've been asked to provide a perspective on how global companies see opportunities in sustainable development. And of course, put in words like that, it sounds like we have a choice. But I would argue that we don't have a choice, that actually sustainability will be the theme that shapes business development, sustainable development in the coming decade. And so I'd like to spend the next 15 minutes to talk a little bit about how we see what that is, why it matters, what are the business opportunities, how is Unilever approaching it, and what is our experience so far. Just as a point of context, I'm sure many of you know this, but the world in which I come from, working, Unilever is a global company with over 170,000 employees, operations in 100 countries, and selling products in over 180, with over half of our sales in developing and emerging markets. Our brands, we make many of your favorite brands, I hope. Foods, soaps, shampoos, toothpastes that are all part of people's everyday lives. And to produce these brands, we use 15 million tons of raw materials every year, coming from forests, areas, farms, and being dug out of the ground. And our brands are present in more than half of the households on the planet and are used 2 billion times a day, often with water and energy consumption. So this has a big impact. This isn't something to turn away from. We have a role, and you're either part of the problem or part of the solution. We've long recognized this. What we now call sustainability has been part of Unilever's lifeblood. And the pioneers who built Unilever companies 100 years ago did that through business success, providing solutions in hygiene and nutrition to people all around the world. And we've continued to do this. I would draw out one other example. For example, in the 90s, when we faced the pressure on fish stocks to make simple things like fish fingers, we worked with the WWF to create the Marine Stewardship Council, the world's sustainable fisheries certification body. And this approach helps to provide fish stocks for the future and, of course, good business. Well, it's important that we're seeing these problems ahead of time and taking stock, because we face huge challenges together. Climate change is accelerating, population is growing, water is scarce. While 1 billion people are hungry, another 1 billion are overweight. And the global burden of disease, including oral disease, is an increasing problem. If we are going to contribute to high standards of living for 7 billion people without depleting the Earth's resources, we, everyone, business, government, industry, large business and small business, must find new models of growth in economic and environmental balance. This is at the heart of sustainable development. And so when I use the word sustainable business, what does Unilever mean? Very simply, it means increasing business growth and our impact and benefits on society, whilst at the same time reducing our impact across the life cycle of our products on the environment. There has to be growth. People want to work in growing businesses. It's very hard to impact the world from a declining, unsuccessful business. And why now? Well, you know as well as I do. The WWF tells us that if we were to consume, if all consumers in the world were to live as we do, for example, in Europe, we would be consuming at the rate of 3 planets. Well, we don't have 3 planets, actually. We have resource scarcity. So we must take action now. And yet there are still billions of people in developing countries who want and deserve the everyday benefits that people in developed countries already have. Clean water, good nutrition and hygiene, oral hygiene, healthy mouths. Business provides employment. It contributes and supports social systems. And this is important in emerging and developed economies. So let's turn to the opportunities. And I feel, and this is important, this is just as important for small and big businesses alike. There is a small but growing number of consumers who want and prefer sustainable options as long as they do not mean compromise in the performance of their products. Next, many retailers are committed to play a role in sustainability, and they need the support of suppliers and partners like us to do so. It's also a fertile area of innovation, creation of new products, packaging and new benefits, and opportunities to open up new markets, to find new consumers, to enable people to consume more sustainably and offer more benefits. And obviously, managing our operations with reduced fuel or resources is good for cost saving. And finally, it's motivating for people. It's a great way to attract the best talent who want to work for organizations who are committed to the future of the planet. And with engaged people comes improved performance. So, turning to what we've done, in 2010, Unilever launched the Unilever Sustainable Living Plan. And it has 3 distinguishing features. The first is it covers all of our activities, all of our brands, across the portfolio in all of our countries. Secondly, it acknowledges and works on the fact that it is not just our direct impact, the impact of our factories, offices, lorries, and laboratories that is important here. It's our impact across the whole life cycle of our business. And so grounded in really objective work at the outset, where we analysed more than 1,600 products across 14 countries, we discover, for example, that 70% of our impact actually comes in consumer use. For example, the heating of water to wash clothes or wash bodies. When you know this, when you've done the objective analysis, it helps you to set priorities where you can have the biggest impact. And thirdly, as I've said, sustainability is not just about the environment. It's also about a social and economic dimension. Our supply chain supports the livelihoods of millions of people around the world, and our products, everyday products that we all use, like soap, toothpaste and spreads, help people to improve their health, their confidence and happiness by changing their habits every day. Having set the groundwork, it's important to set clear ambition and goals, and so we have 3 overarching goals: to help 1 billion people to take action to improve their health and well-being, to halve the environmental footprint of our products, and to source 100% of our agricultural raw materials sustainably, and to do this while doubling our business. And beneath these 3 overarching ambitions are 60 time-bound, quantified objectives, covering everything from salt reduction in soup through to the use of renewable energy in our factories. And to close, how has our experience been so far? Well, a good start, but of course with many challenges ahead. Our business grew well in 2011, the first full year of the Unilever Sustainable Living Plan. And within that, brands that have really embraced the opportunity fast, like Lifebuoy Soap, Signal Oral Care, Omo, Small and Mighty, and Comfort One Rinse, have been growing particularly fast. Regarding the 3 goals, we have a report that's available for all of you outside to take away, so I'm not, of course, going to spend my time in any detail. But what I would say is there are areas of great progress, for example, in sustainable agriculture, nutrition, and the eco-efficiency of our factories. And great steps have been taken in packaging, where we use much more sustainable polymer, recycled polymer in our products, and ensure that our packaging can go into the recycling chain, which Susan talked about. Secondly, there are areas where we've made progress and we can now scale up. For example, Purit, our technology for providing safe drinking water, has been in access to certain states in India so far, and we're now ready to expand that initiative to 5 countries across the world. And there are other areas where we can really see the challenge and now have to make an impact. For example, how to help people shower with less water, or perhaps with less hot water. So to recap, I hope I've given you a perspective on what we consider as sustainable development or sustainable business, growing while adding social value and reducing environmental impact. It's essential. Why does it matter? It's essential now because we face the challenges now, and we must stop living off the capital of our planet, but rather live off the interest. I've shown you some of the opportunities from a global business perspective, which I consider to be highly relevant to small businesses. And I've told you about the Unilever Sustainable Living Plan and our early progress. And I would close with 2 thoughts that will be key to us all delivering success in this area in the future. The first is behaviour change. We've learnt from theory and from practice how important it is to build this in to your plans from the beginning, to be consistent. And we have a model which we're happy to work with you on with the 5 levers that we consider to drive behavioural change. Very simple, actually. And I'm sure any of you who've ever tried to lose weight, stop smoking, drink a little less alcohol will recognise the potential value of this model in just understanding, starting with understanding and leading to forming a habit. Ultimately, it's all about people and what we do. And lastly, it's about what we do together and the power of partnerships. No one of us can tackle issues the size of this alone. And so that's why Unilever is committed to work with a select number of key partners, in which I'm proud to count the FDI and the IADR, and of course the National Dental Associations within the FDI. Together we can shape the future of the planet. And it's discussions like today that form the pioneering thinking that mean we can all contribute. So thank you very much for that.
Peter, thank you very much indeed. We're starting to get down to some more practical examples there of ways in which we can plan and make changes along these lines. So thank you very much indeed for that. Some very good thoughts. Interesting, you said 5 levers there. I thought there was just one, which was the Unilever, but there we are. My pleasure now to introduce David Williams to you. David is a past president of the International Association of dental research, and David's going to look at the ways in which dental research can perhaps start to impact on some of the things that we're discussing today. A huge Hong Kong welcome, please, for David.
Well, I think in keeping with the sort of tone that was established in the earlier session this morning, it might be more relaxed to sit here and talk rather than to command the podium, although I'm happy to do that. Well, first of all, thank you for the invitation to be here. Stephen introduced me as a past president of IADR, and I'll come back to that in a moment. But my current position in the UK is as Professor of Global Oral Health within the University of London. And it's really from that position that I want to begin to come at this topic. And I think in the first two presentations, what we've heard really is, if you like, the WHO view from the edge of the stratosphere gradually coming down. And I think what I'd like to try and do now is to ask how we, as a group of dental practitioners in a range of different global settings, can begin to comprehend what the challenge of sustainability means and how that impacts what we do on a day-to-day basis. I wouldn't claim I've got a lot of the answers to that, but I think there are some interesting practical points that we can begin to open up and explore. Now, when I became president of the International Association for Dental Research 3 years ago, one of the things that I did with the wide membership of IDR was to really raise the challenge about what we do for the world and the burden of global oral disease against a challenge at that time of shrinking, I beg your pardon, probably shaking to economic resources. And that, I think, causes us to focus on the overall global burden of disease and what we can begin to do to address it. And I think there are really two dimensions that we need to think about. One is, how do we, in a whole range of different global settings, think about the burden of oral disease that we have to treat here and now? And I think we need to begin to think about that in a globally sustainable way, and I guess that in a minute Claudio is going to begin to touch on that in a practical way. I think there's a lot that we're beginning to do already in the way we handle materials. We've heard about the challenge of dealing with the phase down in mercury use, and that begins to have important implications on how we practice. But the other bit that I think we need to start to think about very hard is, how do we begin to get upstream to reduce the burden of oral disease? Because if we're trying to face the kind of challenge that we've just heard Unilever deal with, the big issue for us is, how do we give better care to more people with a reduced environmental impact? So if I think about Peter Soer's graph with the 3 lines on it and the virtuous green line going downwards, for us, I think that graph reads just as easily. The other bit is how we deal with reducing the burden of oral disease so that we can treat a larger proportion of people for less resource or using the same amount of resource. And that, I think, means that we need to begin to get upstream to reduce the oncoming burden of oral disease. It plays very much, I think, into the challenge that we've heard about with the Alliance for a Caries-Free Future this morning. But I think it also touches very much on our strategies for non-communicable disease, where I think FDI is taking real leadership. And so the final point that I'd like just to raise for discussion is, what do we do to begin to reduce that burden of disease in a preventive sense? And I think there we do begin to need to begin to start working much more with different agencies to follow the kind of example that we heard being talked about in the earlier session this morning, to work with WHO and our other partners so that we begin to create more imaginative strategies for reduction of oral disease. We need to understand the links better between oral disease and the other non-communicable diseases and work in parallel. And I thought it was very interesting that if you think about Susan Wilburn's earlier comments about health and in promoting health, if you just put oral in front of health in every single one of those first half dozen slides, the messages for us, I think, are exactly the same. So 2 key points, really. I think we need to learn, if we're to be partners in the challenge of sustainability? How do we get to do more with less? How do we deal with the kind of two desirable curves, or the two desirable straight lines, and the virtuous curve of reducing resources? And how do we begin to work in partnership with other bodies to reduce the burden of oral disease?
Excellent. Thank you very much indeed, David. Again, some very good points there. I think one of the other issues here that's emerging is that of partnerships and partners. And I think that's something that we as the FDI can certainly take on. Just briefly, those of you who are gathering for the candidates' presentations, the first session this morning started rather later than anticipated, so this session did too, and we anticipate finishing around about 11 o'clock. So those of you who are here for the candidates' presentations, they will begin at approximately 11 o'clock. Thank you, and as I said, last but certainly not least, from our own FDI, our Science Committee, please give a welcome to Claudio. Claudio.
Thank you very much, Mr. Chairman. It is really an interesting opportunity, and I must congratulate FDI leadership into preparing this new format, particularly the subjects that were selected really pose an opportunity of interaction between dentistry and society at a larger perspective. I have been asked, though, to share with you the experiences that have been accumulated in the past times, working for finding solutions to implement sustainability strategy. I have been had the opportunity to participate as a representative of the FDI at the Rio+20 meetings, and I'd like to also give you a brief report on that. It is just well known that the Rio+20 was certainly the largest conference ever hosted on behalf of the United Nations. Brazilian government, as the organizer, spent over $250 million to receive 129 heads of state and to organize nearly 700 meetings and activities for more than 45,000 participants of 188 countries. That's just to set the scale. But what did it really achieve? Well, apart from a general feeling of disappointment, very difficult to get together and agree on, at least on a global scale, of sustainable goals. Well, while the overall outcomes of Rio+20 have really fallen short of expectations for broad, common political commitment and practical measures, health, and particularly the NCD issues, were really recognized as essential for sustainable development. And as Susan earlier has described in more details, this United Nations conference has really given us the opportunity to show how NCDs are the indivisible links between human health and sustainable development. On behalf of FDI, I have participated in 26 meetings organized by stakeholders from NGOs, science and technology, and even official UN negotiators. The meetings clearly showed that although there is a substantial will for change, an interest of reaction from stakeholders of multilateral interests, the political, economical, and environmental issues involved are far too complex to derive a commitment of heads of states in a global scale. However, other initiatives are really taking form to move forwards towards a sustainable future. And one must say, for example, the C40 Cities Climate Leadership Group, the C40. It is a network of the world's mega cities, and it's committed to addressing climate change. By being the smallest government cell, the cities have a great capacity to interact with citizens and to implement practical solutions for daily life. Susan just gave us good examples of that too. And also, the private sector has also taken clear steps to engage in the global discussion and commit to responsible business practices in order to advance sustainable innovation. Good examples resulting from Rio+20 meetings were, for example, in the Science and Technology Forum, A global-scale understanding is underway to include sustainable development concerns as a transversal axis for research, development, and innovation in all fields of science. And that, David, might just be one way of addressing how to do more with less. The Natural Capital Declaration is a global statement from the financial sector to integrate natural capital criteria into financial products and services. And furthermore, the Corporate Sustainability Forum, held by UN Global Compact, which resulted in more than 200 business practices, commitments for sustainable development actions and green economy. So as you can see, people are working, and there are a lot to do still. Now, the FDI initiative to engage dentistry in sustainable development actions was warmly accepted and received in all meetings that I've participated. Dental profession is an important part of human life and need to take responsibility for integrating sustainable development goals into daily practice. Dental industry, oral health insurance companies, oral health care providers are important stakeholders that can get involved and underwrite to a shift towards sustainable development and green economy. Although it may seem too complex, and it's only the big global corporations and governments that can actually do something, but it's not really the truth. All levels of society can adopt a sustainable attitude. There are several levels that one can act. For example, by advocating to a healthcare model based on health promotion and prevention of diseases, that alone may allow for a substantial reduction of energy use, raw materials consumption, management of toxic waste, and carbon dioxide emissions, just because we have less disease to treat. Science and technology must also engage and be innovative to find new materials and production processes to allow reducing environmental impact. And indeed, a well-structured roadmap of solutions that meet both the requirements of business and the broader needs of sustainable development can be found in the ISO Library of International Standards. International Standards ISO 26000, the social responsibility, is the newest one in that family and represents an overarching approach to sustainability, since it enables organizations of all sizes to progress in all three dimensions of sustainable development: environment, economy, and society. Just to list a few benefits for the dental community of integrating social responsibility into their businesses, derive mainly from improved competitiveness. As Peter was very clear to say, people are much more alert, more and more frequently so, to companies and products that show a greener face. It also helps resource efficiency by reducing energy and water use. It decreases waste and recovery by byproducts. It gives you an enhanced reputation. You get from the public a social license to operate. It creates an innovative working environment. It enhances employee attraction, loyalty, participation, morale, and retention as it improves health and safety. But it also will help you reduce and even prevent potential conflicts with consumers as it improves consumer relations. So in order to translate from concepts to practical actions, I would like to invite all the FDI community in a call for action. Some practical examples of ISO 26000 in dentistry already exist. For example, a dental clinic in Germany at the BEHAVIOUR area has implemented that a few years ago, just after the ISO 26000 was released, and it's one of the good examples for that. Even in Australia, the Victoria branch of the Australian Dental Association is taking up the challenge of incorporating sustainability issues into their practices. The Secretariat of ISO 26000 is held by the Brazilian Technical Standard Association, ABNT. And as chairman of the Subcommittee for Dentistry in ABNT, I will be ready to assist FDI in that liaison. Let us strengthen our partnership with ISO and engage in implementation forms of technical standards into the dental world. The experience gained by working with standards may even create a pathway of development for an FDI seal of endorsement in recognition of sustainable dental businesses, practices, industry. As in many other industries, a well-structured seal of endorsement in partnership with local stakeholders can be very effective in providing a positive stimulus to accept the challenge to move towards a sustainable future. Thank you.
Claudio, thank you very much indeed, and we really are starting to get down to some very good and practical ideas to take forwards. Now, time, as well as everything else, it has to be sustainable. I would like to open the discussion to the audience, though. Is there anybody that would like to grab the opportunity? Stuart.
Thank you. Stuart Johnston, British Dental Association, Chair-elect of the Dental Practice Committee here in FDI, and also I lead the Dental Amalgam Task Team to the Mercury negotiation. So I've been sort of fairly deeply immersed in that Mercury process. And what's striking to me is how the landscape seems to have changed since we started talking about just mercury. We've got involved now in the strategic approach to chemicals management and Rio+20. And the question's for Susan Wilburn. Where do you see the priority areas for dentistry, and where would you think that FDI and WHO could work together to address these issues? Thank you.
Thank you for the question. I think that one of the first areas to begin to work together is exactly what Orlando was talking about in giving examples of where practical dental examples of sustainability are occurring, so that we can together demonstrate the possibilities and inspire the associations and individual dentists to continue to take action. And to that end, I think this area, particularly this year, of the sustainable energy for all and looking at the energy use, electricity requirements in dental practice and how to implement efficiency and renewables there, looking at waste management, and I'm aware of the work that the Federation is doing with UNEP and with WHO in dental waste management in Africa. I think that's critically important moving forward. And then the areas of patient and worker safety.
Thank you, Susan, very much. Thank you. Martin.
Martin Fallowfield, also British Dental Association. It's a question for the whole panel, but also, I think, for the whole industry, really. A washer disinfector uses about 85 litres of water, whilst an ultrasonic bath uses about 4. Of course, the washer disinfector is better, but by exactly how much? Perhaps when we discuss the cost-benefit analysis of these machines, we should be looking at an environmental cost as well as a monetary cost.
Thank you very much, Martin. Peter, could you take that one up in terms of energy and...
Yes. Well, I mean, I can't comment on the specific example, but the mindset is the right one. So I think doing that sort of objective analysis and including both a straightforward financial analysis with the environmental benefit is absolutely the way to go. And I think what has surprised us is that at the beginning, when you face into these challenges, they seem as if they are competing. But as you get into it and accept that it is an imperative to both be financially successful and have a positive role in terms of your impact on the environment, solutions do come. So you start to find that you can find solutions with less energy, more benefit, and a financial positive. And at the beginning, all I can tell you is that they don't all come straight away. It does seem hard, but by embracing it as a must-do, you will find this. And I think it's important to have lofty objectives and some short-term wins. So understanding the overall landscape within the dentist of where your biggest impacts are, and then getting some of these early examples in, whether they're in the biggest areas or not doesn't matter, because it just gives people confidence. But make sure you're clear where the biggest impacts are so that you can shape the programs you take on over time. That would be my attempt at an answer there.
Thank you very much. I think it's an extremely good attempt. Claudio, would you like to add to that?
Really welcome that question, because it gives the opportunity to reflect on how much that discussion could be taken to the national bodies of standards organizations, because it really can have an impact on how you develop the manufacturing process. How much that can be taken in consideration and see, are the results that we are providing sustainable from an economical, but also from an environmental point of view.
Excellent, thank you. Lady at microphone 3.
Good morning to all. More than a question, I wanted to bring you our experience that we have in our country. My name is Selena Cuero. I'm from Costa Rica. And Costa Rica has been well known as an environmental political status country. So about 3 years ago, we started working on a program looking forward to develop a certification for our colleagues in dentistry. So far, we almost have it ready right now. And we're really happy on the results that we already have by the previous studies that we had. So I think this space that we're sharing together is more about bringing the hope and experiences of each country to empower ourselves to do our specific programs in each country. So there you go, that was it. Thank you.
Thank you very much indeed. Thank you. That's very good to know, and a very good example of, I think globally and act locally. So bringing in some themes from Vision 2020, as well as some of the themes from the first session this morning. As I say, I am very conscious of the time. I think we've had an extremely good expose today of the issues involved in sustainability and green dentistry. It seems to me that rather again, as in the first session this morning, one of the messages that's coming across is that we in dentistry, and perhaps we in health, don't have all the answers, and we need to look outside that box, and we need to look to partnerships, perhaps with our colleagues in industry, who obviously have very much more impetus in terms of cost saving and then development and so forth, to help with examples, as well as specifically in the health field with WHO. The other thing I think that the FDI can take forwards is the fact that we need to look politically as well as scientifically. And when I say politically, I mean in a broader social context. So I think that going forwards, perhaps the things that we need to think about in the FDI are both political drivers from the point of view of council and council committees, also scientific drivers, which Claudio has hinted at in his presentation, and to start to bring those together, but also to take this debate back to our own national associations. We have had a couple of questions from the British Dental Association, and I promise they weren't plants. But at our own headquarters at the BDA, our facilities department, for example, are passionate about these issues and have their own prospectus or agenda on green issues, which are things as simple as moving towards energy-saving light bulbs to make sure that all our paper is recycled paper and is then recycled afterwards and so forth. So they're very, in their own way, small things. As Peter was just saying in the answer to the question there, they are very short-term and measurable, but nevertheless are very visible things and start to inspire people to do those things, but also to think about those things. And I think perhaps most importantly today, that's what we can take back to our national associations. This debate could, of course, run on for hours and hours and hours, and I hope it's actually going to run on for years and years and years. I would like to thank the FDI as well for coming up with the subject for this morning's session, and I would particularly like you to thank our panel and our speakers this morning, not just for their contributions this morning, but for the work that they've put in to their presentations. As many of us in the room know, it's one thing to stand up here for a quarter of an hour and speak. It's quite another thing to put all that together and so succinctly. So please, a round of applause in thanks for our speakers. And with that, ladies and gentlemen, I close this session and thank you very much indeed for your attention and your attendance. Thank you.